Okay, so now we can start our session. Before jumping into the direct course, I would like to welcome you all because this is very important. Because you know what? Advanced clinical pharmacy practice and decision making is something new, right? Clinical pharmacy, we all know what it is. What is the basic difference between hospital pharmacy, clinical pharmacy, community pharmacy? That we know, right, on a theoretical level. But what is my motivation behind this course, that I want to share with you, so that throughout the course, you will be having the, required curiosity. And that is very important, right? Just give me a minute. Okay, so before I can share my screen and we can go through the PPTs, I want to share something with you. I really want to tell you that this is the very first module, right? This is the very first orientation, introduction, or else we can say principles we will be seeing today, which is miscellaneous. This particular module has a clear motive, okay? The motive is very simple. My objective is very simple, and that is to make you more curious about upcoming 7 sessions. Okay, so I will share the screen with you. We will go through the PPTs as well for the principles of advanced clinical pharmacy practice and decision making. But before we begin, I want to quickly share a few important, course rules and my expectations with you. First and foremost things is punctuality. Okay, so this is very important. Your attendance will be I will record your attendance throughout the course. In order to get the certificate, minimum attendance is required. I cannot force you to turn on your video and talk to me every time, but your attendance will be recorded. Okay, please make sure that you join every session on time. Late entry disrupt our flow, right, or else your flow, because everything we will be going to discuss for 8 modules, everything is connected, okay, link by link. So that is very important to attend every session on a time. Second, please understand your attendance is mandatory. Okay, 80% attendance I will calculate at the end of the 2 months and the end of the course, and in order to get the certificate you need to complete it. Okay, also if I am going through some of the interaction quizzes and assignments, you should complete it. It is not for increasing burden on you, but it is a sense of responsibility also. And through that activities I will be knowing that you are attending classes, okay, and you are taking it. That's all. So these are few rules and regulations from my side that you need to complete. Okay, so that is very mandatory. Okay, so now let's talk about our course. I'm sharing my screen with you. If see, I'm not providing access to you right now to unmute yourself and speak, because sometime in between lecture, in between session, some disturbances that arises. So that is why I muted you all. But at the end of the session, or else in between the session also, I will give you the access to unmute yourself and discuss if you want any. Okay, please try to make notes if possible, because at the end of this course you will be having a short MCQ exam also. Okay, in order to get the certificate you need to complete that MCQ exam, okay, after 2 months. So after 8 modules. So that is the reason why I'm advising you to make some notes from your side. Okay, and if you have any query, if you have anything to discuss, please feel free to ask as many as questions you can. Okay, we are open for discussion, but at the end. Okay, so that in between disturbances, that not be hurdle for us. Okay, so that is the reason why I am not giving you the access to unmute yourself. Okay, okay, I'm sharing the screen. You can just uh, write in the comments if you have any questions, so that I can see and allow you to unmute yourself, and then we can discuss later, right? Okay, okay, so I hope the screen is visible. Yes? Okay. Okay, let's begin. Okay, so this is our title for the lecture today. See, now you will be getting the point that why we are studying the principles of clinical pharmacy practice and decision making, right? So, shortly, we can say principles of clinical decision making, right? And this is the very first module of our course, Advanced Clinical Pharmacy Practice and Decision Making. Okay, so the duration will be 1 hour, but I want to share today the glimpse and the importance of this topic. Okay. Why? Because every PharmD can relate. Okay. Every healthcare professional can relate that we understood all of the theoretical concept from the book. Okay. We wrote in the exam, we passed it. But when it comes to the practical scenarios where someone asks you that what is the intervention? What can be done here? If this is a side effect which is seen in the patient, what is the reason behind it? Whether it is a drug, whether it is a disease, whether it is some other parameter, then we are clueless. Why? Because we only taught the concepts, the theory, and not the actual skill known as decision making. Okay, so that is my motivation behind this particular title. So you should be aware of what is advanced clinical pharmacy practice. The word itself has meaning, advanced clinical pharmacy practice. And you should be able to make certain decisions in the daily practice, okay, in the daily scenarios. Then and then you can compete what the clinical pharmacist is are doing in abroad. We always we always used to say that the abroad has more opportunity, clinical pharmacist holds more reputed position, and they are also getting more pay. Why? Because they are entitled with the more responsibilities, right? So here in India we need to first evolve ourselves. We need to broaden our mindset that what can be done from our side. Okay, what are our powers that you should be aware of, and that is the exact motive behind putting this course in front of you. Okay, so you should be aware of what are the basic principles of decision making, how to do it. Okay, so the real truth is farmed students are expected to develop the clinical reasoning mindset, because this is the 6 years of course, right? And also it is expected to be able to analyze symptoms, lab values, drugs, interaction, patient condition, and then make a safe recommendation for the patient. But nobody teaches us how to think for it, right? So you learn about pharmacology, you learn about pathophysiology as well, you learn about therapeutics as well in detail, but the skills of decision making is missing. That is what I experienced in my period when I was working as an assistant professor. So the actual mental process behind choosing the right intervention, okay, this is what makes you a real, we can say, clinical professional. Okay, and that is the exact reason why this module is given to you. So today we will be having a major principles of two different critical thinking skills. Okay, overview we will be having, and from our next Thursday we will dive deep into how we can exactly extract our therapeutic knowledge. Okay, from theory to bedside. Okay, so what you will gain from this module we will see today. See, these are the learning objectives. Learning objectives are only the reason behind you will be able to understand on a very first slide that what is coming inside the whole presentation. Okay, so learning objectives are very clear and simple. You can understand it. So by the end of this particular course and the very first module itself, basic, you will be able to explain cognitive basis of clinical reasoning. If you are not getting the point, don't worry. In upcoming slides, we will be discussing each point in detail. Okay, what is cognitive basis? For now, understand the word. We will understand, and you will be able to explain cognitive basis of clinical reasoning. Also, by the end of this, you will be able to differentiate the two different thinking pattern. Okay, the one is pattern recognition and the second is analytical thinking. The name itself has meaning. I will explain you, don't worry. In today, the whole session will be on these two topics. Okay, pattern recognition and analytical thinking. You can say pattern recognition is, traditional practice. Traditional means whatever you have experienced, whatever you have learned, and you are quickly reacting. Okay, and analytical thinking means in a complex cases you need certain things, you invent something different, right? So don't worry if you are not getting, this is just an overview like what is coming inside our session today. Also, by the end of this session you will be able to identify some of the very common bias that can be happen. Okay, so that is also we need to understand. And also you will be able to apply structured reasoning to the cases. How to do it, I will explain you. Okay, so what you will gain from this particular module? So by the end of this module, I can say you PharmD students particularly will be able to understand how these clinical decisions are actually made. Okay, you will be able to recognize cognitive bias that leads to mistakes. You will be able to use structured reasoning approach. Okay, and you will be able to communicate also clinical decisions very confidently. Okay, so I will share some of the strategies, some of the directions for you. On the basis of that you can create a critical thinking, right? So let me tell you a small story and then we can start our session. A very small story, but it is a real one. So I observed, a PharmD intern once, saw a patient in the ICU with the severe tachycardia. I hope you know the meaning of tachycardia. So PharmD intern was the student and he saw a patient in the ICU with the severe tachycardia. Doctor assumed at that time that it was due to the infection that is getting worsened, okay, and ordered a stronger antibiotic for the tachycardia. But the intern quietly, looked at the chart and noticed something very simple. The patient's potassium level was very low. And you know that, right? Low potassium level that leads to this tachycardia situation. So he politely said to the doctor that, sir, could this tachycardia be due to hypokalemia? Should we correct it first? And doctor checked and he was absolutely right at that time. So, in this scenario, do we need a stronger antibiotic? No, we only need a intervention. Okay, so if the potassium wasn't corrected, the patient could have gone into a dangerous arrhythmia because of high dose of antibiotic. So that day, he didn't save the patient through a rare diagnosis. He saved the patient by thinking clearly and by refusing to jump on a conclusion immediately. That is what makes our whole concept, decision making. That is the importance of decision making, right? So this is very important for you. So this course is, not about learning more about theory. Let me just give you a very clear idea. This particular course that has 8 modules is not about learning theory. I am not going to dive deep into theory, right? It is about learning how to think like a clinician, a good clinician, I must say. Okay. And how to analyze like a scientist and how to make decision like a responsible healthcare professional. That is what the main objective behind our course. Okay. So that is the main learning objective, right? Let's begin. Okay. So why decision making matters the most? Why? Now, why is I think now clear. I explain you since last 15 minutes that why this decision making matters the most. I also shared one scenario with you, the real story, right? And how simple thing is observed by the PharmD intern, and that could actually was the reason behind tachycardia, right? So obviously it affects patient's outcome. What is outcome? Okay. And we as in healthcare professionals are evolving around the one centered and that is patient. Okay. Everything we do is for patient. And decision making matters because it affects patient outcomes, right? Also, in a case of complex comorbidities, like the patient is suffering from more than two conditions, and in case of polypharmacy, let me tell you, polypharmacy is the biggest challenge in India right now. If you are following current pharmacy, current affairs of pharmacy, so you should be aware of that polypharmacy is the biggest drug related problem right now in the India, because every elderly patient, if you are observing, everyone is having a polypharmacy case. Okay, whether they need pantoprazole or not necessary to find, but in prescription you will find it. Okay, even if some patients are having statins over since 5 6 years, pantoprazole since 5 6 years, right? And self medication practice, so every case is a polypharmacy. So in that scenario also decision making matters, right? Also it can give you some balance evidence, judgment, and patient's context. I will be explaining you in a short while that why and how this balance evidence, judgment, and patient context that makes sense. Okay, so learn this course, as you know, you are just imagine the whole scenario, and you are particularly into the scenario, and you are the one who is taking decisions. Okay, not as theory. Okay, okay, let's start. First, I will start with the definition. What is clinical decision making? Okay, clinical decision making is not a parameter, it's a process. Okay, I can say it is a simple process of collecting whole patient's information, further analyzing it, and choosing the best evidence based action to improve the overall outcome. Okay, one person cannot give the definition of clinical decision making. If I can ask you also, everyone will have a different mindset related to clinical decision making. Okay, some can say it is better, better judgment or better medicine approach. Everyone is correct in the scenario, but it is the whole process combining patient's information, analyzing it, and choosing the best out of it for improvement. Okay, so clinical decision making involves whole thing like understanding symptoms, lab values, medication, patient history. I am not denying that you are not supposed to read pathophysiology, therapeutic psychology, right? Because the base is mandatory. But once you reach at the stage where your base is clear, then one step ahead, you have a clinical decision making, right? So understanding symptoms, lab value, medication, history, identifying the problems accurately, and comparing possible diagnosis and treatment option all together, and then choosing the safest and most effective plan for your patient, right? And continuously reassessing further the response. That whole process collectively known as clinical decision making. Okay, so in a very simple word, I can say CDM, clinical decision making, is how a healthcare professionals think through a patient's problem. Okay, through a patient's problem and decide further what to do next. That is what clinical decision means, which involves cognitive process of evaluating your whole patient's data, right, at once. Goal is very simple. Clinical decision making has a very simple goal: safe and effective care, okay, to the patient. Also, it involves your perception, your analysis, own analysis, your synthesis, and your judgment. Okay, so this is very, very important to know what is clinical decision making. I hope it is clear and it makes sense. This is nothing like you should mug up all the theory. Okay, that is no need. There is no need of, इसको रट्टा मारने की कोई जरूरत नहीं है. No need to mug up. Okay, you just need to understand the fundamental things, the concept, that what is clinical decision making. So if you are a healthcare professional and you are observing a prescription, so you are going through every medicine, analyzing it, laboratory test, right? And then you are making certain decisions, not as per the traditional practice, but as per your perception, your analysis, your synthesis, and your own judgment. That is what is called as clinical decision making. Okay. So what I have observed in the ward rounds, during the ward rounds, everyone, if you are, going in the cardiology ward, trust me, every patient, whether it is MI or whether it is some other conditions, you will find a same, medicines at the prescription. Same five medicines, maybe aspirin, maybe statin, maybe this. You will find the same medicine list in every prescription. One or two maybe, different. Why these all things are there? Every patient is unique, right? And nowadays, another concept is also there known as pharmacogenomics, where the patient's own genes are responsible for the drug response. Okay, so genes are responsible for how the patient will respond to a particular drug, right? And that is a study known as pharmacogenomics, right? So, how we can go for the same traditional treatment chart for every patient suffering with a cardiology problem? Not possible, right? But these are the scenarios and where exactly clinical pharmacists play an immense, huge role. Okay, you can intervene, you can cross check, you can cross check that whether this medicine is suitable for the patient or not. You can suggest alternatives which are better. Okay, so these all are all these things are comes under the clinical decision making. You will be able to do it after understanding our 7 8 modules. I sincerely hope for that. Okay, let's understand further what are the frameworks of clinical decision making. Okay, frameworks. What comes under the clinical decision making? How we do it? How we can do it if I want to, right? Let's understand it. So, as I earlier said, it started with the data collection and then step by step. Like first it's the data collection, then hypothesis generation. I hope you know the meaning of hypothesis, right? Hypothesis generation, then evaluation decision. Okay, then you are coming towards the one decision, then you are taking a action and you are checking reflection of your action. Okay, that nothing but response of the patient, right? Don't worry if you are not getting it right now. We are seeing this, we will see these things in detail. We will dive deep into each of the principles in upcoming hour sessions. Okay, just understand this is the introduction orientation kind of session only on the principles. Okay, so this is only for generating, making you more curious. Okay, so let's understand the very simple framework of clinical decision making. Okay, we'll start with the cognitive approach to the clinical reasoning. Okay, what do you mean by the word cognitive approach to the clinical reasoning? Okay, so we'll start with the dual process theory. I told you in the learning objective that are we have two process to act. For example, you are a clinical pharmacist, or as you are an intern, let's assume, or a simple student of PharmD, and you are going in a ward round and holding a prescription in your hand, and you are seeing a chief complaints of the patient, laboratory investigation of the patient. Very first thing which comes on you in your mind, okay, that is the actual thing we can say, the exact thing we can say, it is a pattern recognition. Okay, pattern recognition means you are recognizing the patterns which are practiced, okay, since long time. See here, the very first thing we will be understanding here is a pattern recognition. Okay, which is nothing but a traditional pattern you are assuming that will be your answer. Okay, so for example, a diabetic patient with a sweating and shakiness, like likely to cause a hypoglycemia. But this thinking is fast and error prone if it is overused. Now, please understand, pattern recognition is very quick, intuitive, and which is a fast system, okay, which is useful in the common situation. Like if the patient is having diabetes and he or she is sweating and shaking, you will be having a direct, uh, the idea in your mind that this is because of hypoglycemia, because patient is diabetic and having a hypoglycemic agents, right? But this thinking is very fast and error prone. Why error prone? Because you are going on a pattern recognition, you are not checking other things, right? Maybe this sickness is because of some other reason, some other physiological parameters, and that is actual case happening in the wards. Okay, I will give you some real world example as well in this. I am not saying always pattern recognition is a wrong thing. You can identify you can identify pattern which is practice in your ward rounds, in your daily routines, and you can recognize also this pattern, that is completely okay. But combining this with your second analytical thinking, now this is the system 2, okay, which is a very slow, I can say this is the example, we'll see later. Analytical thinking is a slow, structured and step by step response. Okay, slow, structured and step by step reasoning. For example, if a patient's liver enzyme are rising at one hand, So you will be thinking that is it a drug induced? Is it some viral problem? Is it alcohol related if the patient's social history suggests it? Is it a disease progression? Right? So this thinking prevents clinical errors. Okay, but कैसे आ सकता है ये? How you can relate with these questions once you know the whole events of the patient's history, right? So this is called analytical thinking. Now this thinking prevents clinical errors. So basically this healthcare professional need to know when to use which of this pattern, okay, and how to balance both. That you need to understand. Not always we can rely on pattern recognition, which is a traditional practice, okay, to identify and go with the flow. But we should be aware of analytical thinking, okay, to raise questions, okay, and also you should be able to understand when to combine both. Now, don't mug up, don't try to remember these things, because in upcoming sessions we will be having some real world example cases discussion where you will be able to understand where we can go for pattern recognition and where we can go for actual analytical thinking. Okay, so let's understand the case scenario here. This is a dual process in action. So patient presented with chest pain, for example. Patient is presented with chest pain. So in this case, what happened? See this. First time, if you are going with the pattern recognition, you will identify it as an acute coronary syndrome. Okay, any kind of this ACS system. And if you are going with the analytical thing, you will further evaluate ECG immediately. You will check troponin and then confirms. And then you will rule out further, right? So this is nothing but a step by step process in analytical thinking. But in case of emergency, you need to combine both. You need to combine both when it comes to chest pain, right? So you need to combine both your traditional one, recognition, pattern recognition, and your analytical thinking, right? I will be sharing other examples with you, so don't worry if you are not getting it, you will be able to understand. Okay, so here we have a clinical reasoning in pharmacy. See, now this is the concept which is related to our main step-by-step theory. So clinical reasoning is step-by-step thinking process that helps you further to understand patient's own problem and decide the best course of action, which includes very first, evaluate your therapy options, whatever you are having. Okay, compare different drugs, compare different treatments to choose what is the safest and most effective one. And trust me guys, this is a practice which is happening in abroad. Okay, that's where clinical pharmacists are responsible to evaluate therapy options. Okay, individualized treatment, I hope you are aware of the word, which is very popular right now in pharmacy, right, in clinical pharmacy. Individualized treatment, personalized therapy, right? Every patient is unique. So what patients exactly needs, what is the best suitable option for the patient? Okay, that is first thing. Second, interpret labs. So interpreting your lab results. Okay, so that means understanding what is abnormal, okay, in the lab test means, and how they affect therapy. So that you need to identify that what are the abnormal things in laboratory parameters and how it is affecting the therapy. Third one, detect adverse drug reaction and drug-drug interactions if there are any. What are the platforms available for check ADR, right? So identify always the side effects, interaction, and medication-related problems early as possible, right? That is also the clinical reasoning. Then advise prescribers using evidence and judgment to give clear, logical, and safe recommendation. But I know this sounds very nice, advise prescribers, right? But in actual scenarios, when it comes to practical implementation, this is quite difficult, right? Because we need evidences, we need a lot of things in backup to go and tell them, to advise them that this is not appropriate, you should go for something else, or we should go something else for a suitable which is more suitable for the patient right now, right? But I will tell you what is the correct way to approach. Don't worry, we will cover everything. Okay. So you should be aware of these concepts before clinical decision making, right? So you should be able to evaluate therapy option, interpret your laboratory results, detect adverse drug reaction, and advise prescribers. Okay. Let's understand clinical reasoning cycles, which is very simple. Collect information. First of all, you need to collect the whole information from the patient or patient's file. Then process the information. Okay. Understand by yourself first what is the case, what is the scenario, how we can deal with it, that you need to process. Then identify problems. Let me tell you, if you are a clinical pharmacist or you have aim of becoming a clinical pharmacist, this is the JD, job description, right? So identify problems in the prescription, in the scenario, what is wrong here, right? Set the goals. Then you are setting the goals, that what is your goal. Your goal should be lowering the blood pressure, lowering the risk of heart attack. That goal can be any, right? Then you can say your next point is take action. Fifth number, take action. According to your goal, you need to take action. Once you are taking action, evaluate outcome, results, right? You need to be aware of what is the outcome of your particular taken, whatever steps you have taken, right? So evaluate outcome, whether it is happening or not, whether it is affecting or not. Okay. And then reflect. Okay, reflect is a very simple step. So from collecting to evaluating outcomes and reflecting it, the whole clinical reasoning cycles gets completed. Sounds very nice, easy, okay, understandable, but practically difficult to implement. Okay. So let me share you some other things. Gathering information is a very important thing, guys. Okay. From history, labs, medicine, allergies, you should ask patient also, caregivers also, in case of patient is not able to answer, and collect all the information related to history, lab, medicines, allergies if they are having. Okay. Also, reliable sources you should be depend on, whether it is reference books, whether it is online sites, right? Reliable sources should be there. I will also tell you where to search and where to not. Okay. Gathering information and avoid overload. You cannot assess whole 15 cases at once. If you are at a starting point, starting at your career, then you should be only focusing to 2 to 3 cases per day you can process completely. You know, we can say on deeply, you can understand the whole case, right? So avoid always overload. Okay. Also, you should be able to understand interpreting and processing. What do you mean by interpreting and processing? That means taking the raw clinical data, understanding what it indicates, and deciding further what it means for the patient care. For example, I will give you a simple example here. So, this is identifying patterns, okay? Identifying patients. For example, here you can see a patient taking a warfarin suddenly has raised INR. Okay, so I hope you know the meaning of what is warfarin and what is INR, right? Everything we cannot go into deep dive, right? Otherwise, we cannot complete our whole objective for the session today. So if you have any question, we can solve it later. If you didn't get the concept, we'll solve it in question and answer. Don't worry. Okay, just understand the what is interpreting and processing. Okay, so imagine a patient is on warfarin and suddenly has raised INR. When you interpreting and processing this, you are thinking why this INR is high. You will be check the recent changes, like you notice the patient started an antibiotic or not. For example, azithromycin, for example, metronidazole, for example, ceftriaxone, right? You will check that patient's recent changes in the medicine. Also, you will recognize this can increase warfarin level. If patient had this medicine, okay, that can increase warfarin level. So that leads to a higher INR and bleeding risk. Okay, so you process the whole information here. In this scenario, you process, right? So, and you recommended also monitor INR closely, adjust your warfarin dose, watch for bleeding risk, right? And also inform the prescriber about the warfarin and antibiotic reaction. Okay, so that is in short, we can say interpretation and processing, understanding what is abnormal data. Okay, and that means and conducting it with possible causes to guide the safer therapy, I can say. Right? So, this is how you can analyze things. Okay. So, interpreting and processing is a very important terminology you should be aware of. Okay, here I already mentioned SSPKPD. So obviously you should be aware of pharmacokinetic and pharmacodynamic parameters of whatever agents you are analyzing. Okay, PKPD, what body does to the drug, what drug does to the body, right? Then and then you can raise questions like this, and you can be aware that the antibiotic, just for example, uh, ceftriaxone, metronidazole, and azithromycin can interact with warfarin, and that may raise INR level, okay, and bleeding risk. So this is how interpretation and processing can be done. Okay, I will share some strategies with you in upcoming sessions. So don't worry. This is just the overview and the overview of concept. Okay. Okay, you should be aware of the term pattern recognition thinking. As I earlier mentioned, pattern recognition is a traditional practice. You are entering into the cardiac ward and you are seeing every cardiac patient, whether it is MI or ACS or anything, same prescription will be there. That is pattern recognition, right? And according to, if you are thinking according to pattern recognition, that means you are giving a quick response. Okay, quickly identifying a clinical problem because it matches a familiar pattern you have seen before, right? Simple. It is familiar. Okay, familiar pattern you have seen before. Okay, for example, this is fast and intuitive, I can say, pattern recognition, right? Based on experience, right? And very important thing is it increases risk of bias because every patient is unique, every situation will be unique. You cannot always rely on pattern recognition, right? So that is very, very important. I hope it is clear. Pattern recognition, you should be aware of the term, right? For example, we can have example here. See, elderly patient, you are seeing an elderly patient who is on the furosemide and who complains of dizziness. Now, without doing a long analysis, your mind immediately tells you a common pattern. What is common pattern here? Furosemide. That causes what? Fluid loss, right? Furosemide causes what? Fluid loss, right? And elderly patients are more prone to dehydration. So dehydration is the reason behind electrolyte imbalance, and dehydration causes electrolyte imbalance, right? Low sodium, low potassium, and that causes further dizziness, weakness, and confusion. That is the commonest pattern you will identify if the elderly patient taking furosemide has a complaint of dizziness. Now, this looks like dehydration and electrolyte disturbances due to furosemide. That pattern is known as pattern recognition, fast and experience based thinking, right? So this is the explanation. You can see here, you see an elderly patient on furosemide complaint dizziness, and without doing long analysis, you immediately respond. Furosemide responsible for fluid loss, and elderly patients are more prone to dehydration. So that is the exact reason behind dehydration and electrolyte imbalances reason behind dizziness, right? So your brain quickly links this and thinks the same concept, right? That is nothing but a pattern recognition. And trust me, everything you will see on a word will be having a principle of pattern recognition only, which is not good, right? We need to combine it with the this analytical thinking. Okay, analytical thinking is a stepwise hypothesis, okay, logical evaluation, we can say, which is used when the situation is unclear, and this is the best when there is a complex cases. Okay, let me give you an example here of the analytical thinking. See, a patient developed new rash on antibiotic analyzing. Now we are analyzing timing of the antibiotic, doses of the antibiotic, and then we'll rule out the causes. So you will analyze systematically. Okay. You will analyze further the time. When did the rash start? Did it appear soon after the antibiotic or much later? So that you can identify, whether the exact causality assessment with the antibiotic, right? You will see dose and drug details. Was the dose changed? Is the drug known for allergic rash? Any previous history with the same antibiotic? These are the questions you should ask. And don't worry if you are not getting the point, because analytical thinking, I will be, scratching this topic further, for the seven other modules. How to do analytical thinking, okay? In what scenarios you can do, how you can apply. Okay, so these all are the questions. Did the patient start any new medicines right now? Could it be viral rash? Everything you will be questioning, and then you are coming on the conclusion. That is the exact example of analytical thinking, which is careful, more logical, and reasoning to reach the correct diagnosis. And let me tell you, if you have a aim for individualized treatment, personalized medicine, precision medicine, analytical thinking is one of the tool to achieve those things, right? Very, very important. Now, what which is more important is pattern versus analytical and combining both when it is necessary. Okay, so pattern is a fast and experience based, while analytical is a slow and logical. Now you know the basic difference. Pattern analysis, pattern is same like fast and experience, as the name suggests, recognition, right? Recognition. And analytical thinking is a slow and logical. Now let me tell you, both are essentials. Both are important. How? I will tell you. So integrating both, okay, combining both pattern recognition and analytical thinking means using your quick intuition when it is appropriate, but also switching to slow and detailed reasoning when the situation is unclear or risky, right? So that is very, very important. Clinicians always use both. Okay, so this is very important. That is training a safe intuition, we can say. Okay, so I will tell you in what cases you can go for, both. For example, we have a study of hyponatremia. ओके, हाइपोनेट्रेमिया स्टडी देखते हैं, which is a post operative hyponatremia plus low sodium. Now this is a common condition, post operative hyponatremia, which becomes confused and lab shows low sodium as well, that is a hyponatremia. So यहाँ पे pattern recognition क्या बोलेगा? What will pattern recognition tell? So you immediately think like a common pattern, that post operation plus confusion and low sodium, which is a very, very obvious thing because of we can say fluid overload, right? So this is a pattern recognition will say it, whether it is because of fluid overload, right? There is a quick intuition. But what will analytical say? You will check osmolarity, you will check urine sodium, you will also check SIADH, which is a common after surgery, to check pain, nausea, opioids, and anesthesia, right? So this is nothing like fluid overload. Other reasons can be reason behind hyponatremia. This is the particular case I will be stretching further in the upcoming modules. So don't worry, we will seeing this in detail. Okay, how to analyze, what to analyze, and how we can conclude. Okay, how we can reach to the conclusion. So this is the very basic thing we need to understand in our upcoming modules. I hope it is new for you. It should be new for you because the whole title itself, the course itself is a new, right? So these are the things. Okay, let's understand the cognitive bias in the decision making. Unconscious thinking errors can be happen. You agree with the point, right? Unconscious thinking errors can be happen, and it affect your judgment as well sometimes. Okay, how to overcome? We'll tell you the reasons. Okay, what can be the types of bias? What are the types of bias that can happen? So anchoring type of bias can happen. What do you mean by anchoring? So anchoring means it is, you fixate on the first piece of information and fail to adjust your thinking. Very simple. You just speak. Okay. For example, it's just the gastritis and you are ignoring later sign of cardiac pain. Okay. So that is anchoring. Anchoring type of bias is everywhere right now. Okay. I will give you some real world example as well. And types of bias is also one of our topic to discuss further on half an hour or maybe 40 minutes. So don't worry. Okay. This is just the overview. Confirmation bias can be also happen. So, you look only for the information that supports your initial belief and you totally ignore anything that, contradicts it. That sounds, familiar. Okay. For example, believing a drug is the cause. So you focus only on the data proving it. That is a confirmation type of bias. Okay. Availability bias means you judge based on what comes to your mind very easily, what is available, recent and memorable cases. So when I do the viva of the students, no, they will always go with availability bias. Okay, they are always on the things like what is coming inside their mind very easily. Okay, So, for example, you recently saw a dengue case and assume that all the fevers are because of dengue. That is availability type of bias. Okay. Overconfidence bias means you are very overconfident. I am sure it is not an ADR without checking labs or interaction. That is a simple example. And framing type of bias. Framing means, that mild fever after surgery sounds harmless, but you might ignoring infection risk at that time. That is framing. Okay. So this kind of small bias can occur while making clinical decision making. So I have included one slide for you, whatever I have explained. See, anchoring type of bias, confirmation bias, right? Believing a drug is the only cause. Then we have framing type of effect. We have availability bias, right? And we have overconfidence bias. So this is only for your information. I have, putting a slide, okay, with the examples to understand. But don't worry, we will be understanding each of the bias in detail. Okay. Okay. Decision support tools. Now, what are the tools available for supporting our decision? Okay, so we have a number of tools with us that supports our decision. Okay, that helps further us to make very faster, safer, and also evidence-based decisions. We have algorithms and guidelines with us. Okay, we have algorithms and guidelines which step-by-step recommended recommendations, provide for diagnosis, for treatment. For example, sepsis protocol, we have antibiotic guidelines, we have, right? Also, we have a decision trees. Decision trees means flowcharts. Okay, flowchart style tools that guide further the choices based on yes and no question. Decision tree generally, act like that. Okay. Also, we have some of the CDSS tool like clinical decision support system. Clinical decision support system, for example, renal dose calculators. Okay, we have tools that uses creatinine clearance or EGFR to adjust the drug doses in the kidney impairment. Please understand, this is very, very important. I always ask students that whether you are going with the decision support tools or not in the board rounds, right? And everyone said no, because only micromedics, only some of the very popular tool med stoppers they are aware of. They are not aware of clinical decision support tools. It, the name itself has meaning, guys. Clinical decision support. Okay, so it actually gives you support to make actual decisions related to your clinical scenarios. You can use it in your daily practice. Okay, so very, very important. Okay, so what is evidence-based medicine? I hope you are aware of the term EBM, evidence-based medicine. That means making a clinical decisions using the best available research evidence with you, which combine further with the clinical expertise. See, best possible evidence combined with clinical expertise and patients' values and preferences. So, in short, we can say EBM is using a proven scientific data to guide safe and effective patient care. Okay, so evidence-based practice is a very must. Okay, for example, anticoagulant choice scoring. Okay, I will be having a whole example of this particular thing because this is very important. Anticoagulant choice scoring. But if I want to explain this, I need a whole 20 minutes. Okay, so in our upcoming sessions, everything will be there. EBM is also a whole topic to discuss. Okay, this is an overview for you. What is coming inside your 7 modules, right? So please understand. What is reflective practice? Reflective practice, you can see mirror here. So, reflective practice is the process of thinking back on your clinical experiences. Okay, what went well? Okay, what didn't went well, and what you can improve next. That is reflective practice. So, every healthcare professional should practice reflective things, right? So, that helps you further to learn from your real cases and become a better and safer clinician or a healthcare professional. Post decision reflection. I don't think so. Anyone is that is up to a follow up, right? This is a part of follow up. So your teachers are always used to tell you that go and check the follow up. Do take the follow up from the patient. Take the follow up from the cases you are taking. That is nothing but a part of reflective practice. This is very hard. Let me tell you, this is very hard. This needs consistency. right? So I will tell you some of the strategies. You will ask what went well and what not. That is a reflective practice. And now we have some common errors to understand. Jumping to the conclusion is a commonest error. Okay, you will be experiencing. That is wrong. Memory reliance. So some of the clinicians and healthcare professionals are always used to rely on the memory. Okay, that is also very wrong. And ignoring patient's preference. That is also wrong. Okay, so these are some of the very common type of errors that can be happen. Also, we need to understand strategies for better judgment. Strategies we need to make, and that is what coming in our upcoming sessions, right? Slow reasoning for complex cases. How we can do it? How exactly we can do slow reasoning? Okay, how we can cross check guidelines? Which guidelines we can use? Okay, that we will see in our upcoming modules. And team discussion is must. You should be having capability to do a team discussion. Okay, so these are some of the strategies for better judgment. Okay, and what is interactive reflection? So interactive reflection is also a very important thing. Like if the low potassium, after diuretics, that doesn't mean you should directly jump and immediately go for a potassium chloride without any assessment. Okay, so which type of error this is? Let me tell you. If the case is like that, low potassium after the diuretic use, and clinician, or a healthcare professional immediately give the decision potassium chloride without any further assessment. So here the possibility is very high of your which type of bias? Anchoring, right? So this kind of MCQs also you will be solving in upcoming sessions, that which type of bias it is. Okay, so please understand we will be having a short discussion on types of bias, and you will be able to understand, and you should be able to remember also that this kind of bias can be happen. Don't try to mug up ABCD, the names of it. Please understand the meaning of it. Okay. So the answer is anchoring bias. Here, the healthcare professionals are now anchor on the first obvious explanation. Okay. And jump into the treatment directly. So this is very important to understand. So take home message for today is blend of art and science. This course, particularly advanced clinical pharmacy practice and decision making, is a blend of art and science. Art here means thinking. Okay, and science means your theoretical concept, right? So it is a blend of both of the things. Also, you should be able to understand balance, intuition, and analysis. Now you know what you mean by intuition and analysis, right? We have two things with us. We have the pattern recognition. We have analytical thinking. Okay, one is on the intuition, one is on the critical thinking. So you should reflect often on the same thing. You should take follow, and you should recognize bias. That is the take home message for today, right? So these are the references, but don't try to read this right now. I will tell you at what time exactly you should go on a reference, right? For right now, you don't need to. For today, you just need a curiosity. I hope this session, ignites a curiosity inside you for upcoming 7 lectures. Like now, the question should be there in your mind that how we can solve these queries, right? So, yes, now we are open for question and answer. Healthcare professionals who think deeply decides better. That is the deepest truth for today, right? Okay. So now we can go for question and answer. Just a minute. I will give you access. Screen was not visible. Just a minute. I'm giving the access. It was visible. Okay. Thank you so much. Okay. Now you can turn your mic on, and we are open for the question answer if you have any. Okay, there is one question from Dr. Jagriti. Ma'am, what are the clinical decision making tools and tool on intern or a CP should use on a daily basis? See, CDSS clinical decision support tool system is their whole, but still we have some of the another algorithms and scales and some very big things. In our upcoming session, we will be having therapeutics, right? Therapeutic related scenarios where I will include some of the real case scenarios, because this is a broad question, right? Broad question, I mean, if you are in a cardiac ward, you are intended to use some of the specific algorithms and specific scales and some and clinical decision support tools. If you are in a neuro ward, different tools are there. So based on the cases, I will discuss and let you know one by one what are the tools you can use. Okay, this is the exact reason behind this course. So don't worry, every question you will get the answer. Okay, for right now, relax and just understand what is the concept. Okay, because I don't think so many will be many was actually able to understand the title of the course itself. Can you repeat the case you told us in the beginning of the section? I think we discussed almost 3 4 cases today. Minor, which one are you talking about? You have doubt about if the patient is suffering from hypokalemia. ST elevation is also CPK value is about 17. What should we conclude? Hypokalemia or ischemia or other heart problems? See, that is completely depend, Mayuresh. This is completely depend on the case itself. You should be aware of the whole scenario, not only these values, right? So you cannot directly jump. You should be aware of the whole scenario and the mechanisms, right? Then you can jump into it. What is the patient scenario? What are the chief complaints? Okay, what is the history of the patient? Everything should be there. See, don't worry, cardiology is my favorite area always, so I will always include examples and number of examples of from the cardiology unit, right? And we will discuss everything in our upcoming session. Right? Any more questions? Yes, I can explain anchoring bias again. Anchoring bias, anchoring bias is you fixate on the first piece of information. First piece of info, you rely on the first piece of information, whatever you are getting, and you are failed to adjust your thinking accordingly. You cannot think broadly. That is anchoring bias. For example, you are just, telling that it is a gastritis. If the patient is suffering from a cardiac pain, it is gastritic, it is for because of the acidity. Okay, and that is the anchoring bias. At first you are fixed on the first piece of information. We have a separate 20 25 minute of discussion on types of bias, guys, right? The today's session was only briefing and overview what is coming next. In case where the patient saved someone's acha, okay, the real example, right? So that was the case of I guess you are talking about the case. Let me just go through the PPT. Okay, you are talking about potassium level. Okay, so patient potassium level was very low, right? And that patient was suffering from tachycardia. So tachycardia की वजह से डॉक्टर clinicians, that at that time they ordered stronger antibiotic, and they missed the simple thing to check this potassium level. So if the potassium wasn't corrected, the patient could have gone into the dangerous arrhythmia. That was a simple scenario. Skill workbook or reference book for this skills in farm. See, there is one single book I have in my mind. So I will pin and I will give you the book detail and the link also, because soft copy is also available. I will give the link into our group. For sure you can read from there. Okay. Oh, thanks for the reminder. Attendance, yes. Just a minute, I am taking a video today for your attendance, because form will be available. I think that our team will share the form. Okay, your attendance is done. Okay, so see, if you have any more questions, we can discuss in our upcoming Thursday, right? Or else we can discuss in the our WhatsApp group as well. Okay, so for right now, I have another lecture at 7:30. So we need to wind up, guys. But I will solve your each one question. Don't worry. Okay. Our upcoming session is on therapeutics, so it is very, very important. Please understand the importance and see you guys on next Thursday. I hope you will join. And I hope this session is fruitful and you know the whole, concept, like what is the reason behind this particular course. Okay. See you guys on next Thursday as we take your clinical decision making skills into advanced pharmacotherapy. Okay. So we'll see advanced pharmacotherapy, which meets the real world applications. Okay. So, okay. Thank you so much, guys. Thank you for joining. Thank you.